Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. In this edition, I want to cite some really important statistics regarding diabetes and prediabetes that I think are very compelling. Now, let's remember that 90% of diabetics have type 2 diabetes, and that 80% of the individuals with type 2 diabetes are overweight at the time that the diagnosis is made. So we know that being overweight and out of shape causes insulin resistance to occur, which is the underlying dysfunction really in type 2 diabetes, insulin resistance. So insulin resistance means that your cells, particularly your muscle cells and your fat cells, which comprise 2/3 of your body mass, have a hard time absorbing glucose or blood sugar from the bloodstream, and thus the pancreas is forced to pump out really high amounts of insulin for those cells to be able to extract glucose from the bloodstream. Now, when you do aerobic exercise and you lose excess body fat and you shrink your fat cells down, it produces insulin sensitivity. It's the opposite, which enables your muscle cells and your fat cells to extract glucose or blood sugar from the bloodstream in the presence of much less insulin. So when you're more aerobically fit and leaner, your pancreas doesn't have to pump out high amounts of insulin. Now, this is very beneficial as high insulin levels convert carbohydrate into fat, which in turn causes your liver to synthesize way more cholesterol to transport the fat through the bloodstream to get it over to the fat cells. And the extra cholesterol that you produce gets lodged in the artery walls, causing narrowing of those arteries, which leads to heart attack, stroke, kidney failure, and blindness from macular degeneration as you clog the little blood vessels in the back of the eye. So, and higher blood sugar, which you see in diabetes, that's part of the condition, produces inflammation in the blood vessel wall, which further increases the risk of heart attack, stroke, kidney failure, cataracts, and blindness from macular degeneration. The truth is that in the case of type 2 diabetes, most diabetics have the power to get their blood sugar, cholesterol, body fat, blood pressure, and triglycerides under control through meaningful dietary and exercise practices. So here are a few important strategies to make that happen. Number one, eat less refined sugars and use beans and peas as a substitute for other starchy vegetables as often as you can, so you're reducing your intake of bread, pasta, rice, and potatoes, which are very glycemic. Beans and peas actually lower cholesterol and they don't spike your blood sugar. Also, you want to avoid high-fat meat and high-fat dairy products because they turn on cholesterol production, which clog your arteries, and also deep-fried foods and foods with a lot of trans fats. And you do a minimum of 30 minutes of aerobic exercise at least 5 times a week. So when you put that together, the reality is that much of the fate of diabetes lies in the hands of the diabetic. Relying exclusively on drugs to manage the condition with little attention to real lifestyle change has created some serious consequences in recent years. Here's what the data actually shows us. Diabetes is the leading cause of kidney failure, and it accounted for 44% of all new cases of kidney failure in the year 2008. Now, with kidney failure comes the need for dialysis 3 days a week. This is not a fun way to live, and or the necessity for a kidney transplant just to stay alive. This is preventable. Diabetes remains the leading cause of new cases of blindness in adults 20 to 74 years old. The leading cause of blindness. Adults with diabetes have heart attack death rates 2 to 4 times higher than adults without diabetes. And risk of stroke is also 2 to 4 times greater in diabetics than in non-diabetics. 60 to 70% of people with diabetes have a mild to severe form of nerve damage from high sugar and cholesterol levels, which damage the nerves, with symptoms that include impaired sensation or pain in the feet and hands, carpal tunnel syndrome, and erectile dysfunction. Almost 30% of diabetics 40 years and older have impaired sensation in their feet because the nerves are already being damaged. More than 60% of non-traumatic lower limb amputations occur in diabetics. Now, if diabetics get to work on their lifestyle plan and simply lower their hemoglobin A1C from 8% just down to 7%, 1% change, they reduce the complications of eye, kidney, and nerve damage by 40%. Now, lowering hemoglobin A1C occurs when you eat less refined sugars and starchy foods, and you exercise more and you get your body fat down. That's how it gets done. Better blood sugar control in diabetics reduces risk of heart attack and stroke by 33 to 50%. Improved LDL cholesterol can reduce risk of heart and vascular complications in diabetics by 20 to 50%. In the management of type 2 diabetes, medication is important, but changes in diet, exercise, and lifestyle are proven to reverse many aspects of the disease and significantly reduce risk of kidney failure, high blood pressure, heart attack, stroke, blindness, nerve damage, and lower limb amputation. Now, in the U.S., type 2 diabetes affects 8% of the population. That's 28 million people, and more than 70 million people are now pre-diabetics. So that's almost 100 million people that are either diabetics or pre-diabetics. In Canada, 9 million of the 35 million people that live in Canada have diabetes or pre-diabetes. It's a modern day epidemic that is driven largely by faulty dietary and lifestyle habits in the case of type 2 diabetics, which accounts for 90% of all the diabetic conditions. So I can't emphasize enough the importance of proper diet, exercise, and weight control in preventing type 2 diabetes and in reversing many features of the disease and preventing its complications. Type 2 diabetes is primarily a lifestyle disease, and you have the power to prevent it, reverse many aspects of the disease, and reduce its complications. So I've listed the reference for this data in the text below. So until next time, I will encourage you to eat smart, live well, and I know you're going to look and feel great. It's worth it. Thanks for watching.